Welcome, guides of 2024. This is the training for first aid kits from 2023 that we wanted to get everyone updated with. So first off, Mountain Mamas has 5 different kinds of 5 different kits. Most of them, kit 2, 3, 4, are just our regular kits that you guys, assistant guides and everyone will be taking on your trips. Kit 1 is our lead guide kit. It has some extra bonus material. It has a SAM splint. This is for helping if you need to do C-spine precautions or splint with the wrist, things like that. It also has a pulse oximeter for checking oxygen and heart rate. And then it has a tourniquet as well in the bleeding section. So right now, those are the only 3 things it has. We will use kit 1 anytime there's an overnight trip or anytime we're doing any sort of lead trip, like an intro clinic or an extreme trip. We want to have the full kit out there with you guys. Our bonus kit this year is kit number 5. Our biking guides got kind of tired of carrying the entire kit with them, though I do realize that I feel like mountain biking is one of our main activities where you would totally use the full first aid. I don't know. My trips, sometimes we get some bangs and bruises on them. But from now, this is our new biking kit. I just wanted to show this one to you first. So inside the kit itself, it has your basic first aid stuff. Band-aids, Q-tips, all the stuff for abrasions, everything. We also have a new addition this year, a finger splint. This is a SAM splint, which is foam on a piece of aluminum. But I have this in here for fractures of fingers. And then the bike kit also has a lot of extra bike stuff. So it's got a toolkit, a device here for blowing up tires, CO2 cartridge, little mini patches, and your levers for changing tires. So it's got all the tire, just basic bike maintenance stuff is in the bike kit. All right, so hopefully you biking guides will be excited for that. If you like it, we'll get another one. So we're just testing that this year. So I wanted to kind of run you guys through, usually on our first aid kit training, we dump out the whole kit and have you guys put it all back together. I feel like it's the easiest way for you to get good hands-on experience with what's actually in the kit. So I do recommend anytime you go on a trip that you would be able to go through all the stuff in here and just be able to know what's in here. So take a look at the kit if you get a chance before a trip if you're not quite familiar. The kits have been divided into different sections and they're all labeled. The best way is to open up the top kit under safety. There's a booklet. This is called the First Aid Backcountry Kit, Backcountry and Extended Care booklet. This is a Cliff Notes of the Wilderness First Responder guidebook that we use, as well as all the lead guides are trained as WFRs, Wilderness First Responders. So this is the kit, or this is the book that we use. So that is the training. This is the little book that you guys get to have in each of the kits. It has everything in here. If you want to know, on the back, it's got like bleeding, fractures, whatever, stings, bites, like look it up on the back and it'll show you here in the book. Super easy. We love this book. So definitely know that this is in there as a resource for you. Also in the same Ziploc are our paper notes that we've got. Anytime, it used to be a policy that anytime you open the kit, we wanted you to fill out an incident report. I'm going to let you guys use your judgment on that. If someone has just like a little blister or a little cut and you want to give them a Band-Aid or needed a little ibuprofen and things like that, you can give them that stuff and you don't have to fill out an incident report. Do know the caveat to that is if you don't document it and something else happens in a week or two and there's nothing documented, it's on you. So if you see an injury, you're like, this could become something potentially bigger, fill out an incident report. We had a woman get a laceration on her hand. Our guide took great care of it. And a week later, she comes back to say, hey, you know what? I needed to have stitches on that. But luckily, our guide had done everything she needed to do and had documented stuff. And so we were okay and we were covered. And of course, the woman didn't want to sue or anything. But she was just saying, I just want you to know that sometimes things change on wounds after the trip. So document if you can. I also recommend you also take a picture of anything that happens on your trip, any injuries. Anytime you do say take a help with a blister or something like that. Take a quick picture. It takes 2 seconds. That way we know if something happens after the fact, you know, that we have some record of what it looked like then. Then you want to email that, of course, to your base commander. And so we have records of that, or to the Mountain Mamas, mtmamasutah@gmail.com. So we would prefer to have that. Our incident reports look like this. They're just a 1 page, and then you fill it out with the patient there. So there's there. We have pen, pencil in here for you to fill this out. So after you've taken care of them, write down the stuff, write down what happened, and have them sign it. You sign and they sign, and that way that really helps. If for some reason it was a craziness, or sometimes you find out after the fact or things like that, we do have incident reports that you can fill out as a DocuSign document. And so just let us know at Mountain Mamas, and we will email one to you and to the gal that was injured, and they can fill that out and send that in as well. But definitely do always fill out these incident reports. If something is concerning where you're actually monitoring somebody over time, head trauma, bleeding, altitude sickness, anything like that, we want you to also fill out what's called a SOAP note. The SOAP notes have been trained, people who have their wilderness first responder training, all our lead guys should be trained on how to fill these out. They're pretty self-explanatory. You kind of write down who they are, you know, and what happened, and there's a place to monitor vital signs over time, and kind of there's a place where there's a person here that you can say injury 1, and then circle 1 on the actual picture of where that injury occurred. And then under plan, it's like what I did to fix that problem. So if someone has multiple wounds, head trauma would be 1, then abrasion on the right arm is 2, you know, you would circle that on the person and then fill that out here. And then that's pretty easy to follow as well. And then make sure you follow that over time and fill that in and give that to us. So those are our 2 documentation papers, as well as in this paper with this booklet here. We also have, this is super important, the master key of what the heck's in this kit. There's a whole bunch of stuff. And sometimes you're like, I don't even remember where that thing was. So the kit has broken up into different sections: safety, survival, equipment, medications, bandaging, and bleeding. And those sections are labeled on the kit in here, okay? So to go over safety, I'm just going to go through each of these sections and kind of explain what's in each of these areas for you, so you kind of know. All right, so first off, for safety, safety is located here. Big thing that says safety. This is going to be all your stuff to keep yourself safe and the other people safe, just basic stuff. So this is where you're going to have, most importantly, your gloves. So as soon as we get in to take care of anyone or anything, you've got gloves in here. All right. We also have your hand sanitizer. We have a mask, N95, and a regular mask. We have CPR, little CPR mask there. We have antibiotic. These are BZK antiseptic towelettes. This is for cleaning equipment, not people, not people. Okay. All right, so it says clean equipment only. We had to add that this year. All right, you've got your ACE wrap. You've got your splint, your little SAM splint for fingers. You have your goggles. This is used, women can use this as an extra pair of sunglasses, and then you can use it if there's stuff spraying. You've got this as well, okay? Incidentally, if stuff fluids are spraying everywhere, you also want to have a rain jacket if you have one on that protects you too from bodily fluids. We also have tongue depressors. We have eye lubrication for any eye injuries. And then we have safety pins as well. All right, so that's all our stuff for our safety section. All right. Okay, next I want to take you to survival. So a lot of times you're going to be just using, I'm like, I just need a lighter. I just need a knife or something like that. That's located in the survival section. That's here. And it's behind all the bandaging stuff. Behind, okay? So we go in here. So this is stuff that if you had to spend the night or just needed some basic, stuff to help out with some quick emergencies. Got a flashlight with batteries, lighter, whistle. We've got your garbage bags and Ziploc bags if needed for shelters, or if you have something going on and you need to have a safe place to put bodily fluid and stuff, soak stuff. We've got hand warmers, and we have ice packs. together. And then we have your survival blanket. We have zip ties and icing, cake icing. We use this for diabetics. If anyone's suspected to have low blood sugar, you actually can put this on the bottom of their gums inside their mouth, and it can be absorbed through the mucous membranes in about 15 minutes, way faster than if somebody swallowed something. Also, if somebody is not doing really well consciously, this is the better option than having them swallow something. All right. All right, so that's our safety section. So remember, it's behind the bandaging. Okay, equipment. Equipment just is one section right here in the middle. These are just your tools. You've got your tweezers. You've got your regular scissors, cutting bandages. You've got your EMT shears. This is for cutting clothing or anything that needs more, needs to cut something more burly. Then we've got our hemostats. Hemostats you pinch together and they open, and then they're just used to pinch things that need a lot of grip, and then they'll lock if they're small enough. You can just use them. We mostly use these for carabiners, locking carabiners that get jammed. Works great for that. So, okay, that's our equipment. Medications. Don't be intimidated by the medication section, and do use these medications. We put these in here for a reason. All right. Over here we have super glue, or you can use this for putting together lacerations that are bleeding. Once they're dry, not bleeding, you can use super glue here. It's a great way to bring those together. Under pain medications, we have Cetapin. That's Tylenol, acetaminophen, Cetapin. These are all international names for medications, so I'm sorry. It's written in your list. This will tell you what the medications are that we call them, and then the name that's in the kit. All right, but we have Tylenol, we have aspirin, we have ibuprofen. That's listed as ibuprofen. That's all listed in the pain section. All right. Under meds and medications, we have Pseudotab, which is for runny noses, you know. And then we've got Diamode. This is for, it's an antidiarrheal. This is your Imodium. We have Diotame. They're Tums for upset stomachs. We have Difen, which is diphenhydramine or Benadryl for allergic reactions. So those are our medications for that. For the medication section, wipes. That's alcohol wipes, iodine wipes, anti-sting wipes. All those kind of things are in the wipes category. Gels, we have Neosporin. We have burn creams. And we have Burn Shield as well. All right, now we get to bandaging. Bandaging is in the section in the middle. It has this big thing that says bandaging. There are two pockets. Sometimes people use both, sometimes people use one. Essentially, these are just a bunch of Ziploc bags with different sizes of bandages. So we've got your regular 2x2 gauze, and 4x4 gauze comes in packets. You should know that there's a different kind of gauze called non-adherent pad. This is different. This is the shiny bandaging stuff that you have when you are like when you have on a regular band-aid, you look at that gauze, it's like shiny non-stick. That's what this is. All right, so there's a difference if you just want gauze or you want this. This does not absorb as well as gauze does, but it doesn't stick. So you just decide what you need as far as that is concerned. Bandages, we have some large rectangular bandages, just regular bandages. We have the knuckle bandages and we have the fingertip bandages as well in our bandaging kit here. Then this is my favorite bandaging section. Ziploc, it has a miscellaneous. As a bandaging nurse or a wound care nurse, this is my favorite part. We don't have nearly the cool things I want it to have, but we have some good stuff. First is this, it's called Duoderm patch. They're kind of like these yellow rubber things. Are great on blisters. You can just throw them right on a blister. We also have moleskin in here as well. If it's the blister hasn't fully formed, it's starting to get rubbed. We have an eye pad for eyes. We have clear Tegaderm. This is meant, it's or called Opsite. If you have a wound that doesn't have a lot of drainage on it, but you want to be able to see it, it's great. It just sticks right on. It's kind of like cellophane, I guess. Sticks right on there. Good for just small things. We have your steri strips, butterfly bandages are in here as well. So that's kind of your miscellaneous bandaging set. All right, last section is our bleeding section. We have this as just one section, just in case someone's bleeding and I just want to rip up my kit and go to the bleeding section. I zip it, unzip it, and all the stuff you need for bleeding is in there. So you've got some gauze on the other in the bandaging section if you just need little gauze. But if you need lots of big things, we've got it all in here. So first thing, we've got your ABD pads. These are bigger pads of gauze. You can just throw those right onto wounds. We have 2-inch and 4-inch gauze rolls. So you can use this to pack a wound or to roll around things. We have medical tape. We also have Coban. This is a 1-inch. This is also meant to rub around things. This just doesn't stick to skin or anything like that. We also have a triangle bandage for slings, all that kind of stuff. It does come with, they do come with their own safety pins in there too. We have Q-tips as well for cleaning out wounds and getting under stuff. We have a syringe here for irrigating. So you just take some water, clean water, and then you just use this to squirt in and clean out wounds as well. We have a scalpel for getting rid of any dead or nasty stuff. A knot for surgery. And then my new addition is we have Quick Clot. So this is just, we've separated it into our 4 kits. It's just gauze. It's got mechanism in it that actually causes the bleeding to stop quicker. So if you have a really bad bleeding wound, you can, after you clean it out, you can just pack this in there and that should help cause things to clot a lot faster. All right, so those are our first aid kits this year. We're super excited. Thank you so much for helping our women and keeping them safe.